And now finally I would like to invite Dr. Jolly, our consultant psychiatrist, to say a few words about dementia. Thank you.
Very good. How long have I got, did you say?
20 minutes, 25 minutes. Will that be okay?
No, it said the curry was it.
It's not arrived yet, so read into that.
We'd have to wait for the aromas to.
Yeah.
And I can just keep on going until then.
Absolutely. Provide the entertainment.
No pressure then.
Well, it's been fascinating, hasn't it, really? Amazing. And I thought we were coming for a meeting about dementia, you know. I thought, you see, I went to the doctor yesterday for my annual heart check, you know, like you do. And there was a nice lady, and she sat by the computer, and she asked me a question. She put it in on the computer, and she asked me a question, put it on the computer, she asked me a question, put it on the computer. And I said, who reads that? Who reads that? You know, who's it for? And she said, well, we just put it in there, and it helps us see how things have changed from last year. You know, she said, have you had any heart pain? I said, no. I mean, I was just lying, wasn't I? I was just because I wanted to get out. And I said, well, can you give me a printout of it? Well, I get a printout, it's my stuff, you know. She was absolutely bewildered by this. Really what I was trying to do was get her to turn away from the computer and talk to me, which I didn't succeed in at all. I mean, it's a bit of a worry, isn't it? It's a worry. I mean, I think it's so important that we collect information and so on, but I can't do that. I can't be putting stuff on the computer all the time. And as we've been going along, we said, wasn't it easy when you just went to the doctor and you said, this is what's going on, and the doctor talked back to you and said, oh, this is what I know, because the doctor didn't know much. And I think it's a bit of a worry that people have so much information. For a start, sir, if you feel that what a quality service for me is putting everybody's head in a box to have a non-contrast MRI scan, I'm a total failure, because Darian will tell you that it's very hard to persuade me to ask for an MRI scan at all. Probably 2 a year or something, out of the 300 people that we refer. Why? Because do I learn anything from that? It's going to influence the decisions of what we're going to do. Bugger all is the answer, for the most part. But well, we're selective, that's the point, we're selective, aren't we? So what are we going to do about dementia in Tameside and Glossop? And I'm saying that because I'm really frustrated. You know, we've got now, some of you will have noticed, a lot of interest in the media on this condition. You know, we have wonderful, marvellous people who have said, look, I've got this condition, or my mum's got this condition, and have put themselves on the television or in the newspapers and told us about it. And we've got the launch of what's said to be the first national dementia strategy, which I think is a bit strange because I've been doing this business for 35 years, you know. And you think, oh no, I've been doing it for 35 years. And the answer is, Dr. Hans told me, I've been doing things that's no evidence base at all. Like taking history from a patient and getting to know about them. No, there's no evidence that that's a useful thing to do. But well, I think it actually works pretty well. But this is a time where we should be getting on and doing things. What does the National Dementia Strategy say? It says there are 3 things we need to do more about. And all 3 have been talked about tonight, which is great, but I'm still not quite clear what we're going to do. The first is to make sure that people are aware of this condition. Yeah? Make sure. Now the media and ordinary people are also doing quite a big business, and there is a need, of course, in particular groups of the population. Learning disability area is an area, and minority groups. And we worry. Before I came, if you like, back to the northwest, I was in Wolverhampton, which is my hometown, and we have a large Sikh population. So we did a lot of work with the Sikh population. Tameside's marvellous because you've got all sorts of bits and pieces, haven't you? Did anybody speak Italian? Yeah. probably you can. Can we get Italian speakers? We've got Polish speakers, we've got all sorts. And one needs to be helping people know, what are we doing about that? What are we going to do about that? That's the first thing, to make people aware. And the discussion has been open for us. Is it just old age? Or is it something you should be looking at carefully, something that may, over the period of time, turn into something rather difficult and sinister? I'm pretty worried about overselling things, I tell you, because quite a lot of people do become forgetful, and dementia is actually a pretty variable condition. If you look at what the prognosis is, it's very difficult in an individual case to know exactly what's going to happen, whether it's Alzheimer's disease, or gene-fog disease, or what have you. And the important thing, and I think what general practice does very well, and what families do marvellously, is this is still a person, this is still an individual who is being changed by this condition, and by the passage of time, and by other conditions that happen, you see. Another thing that I'm privileged to do is to do a memory clinic in primary care in Staffordshire once a month, and I'm pleading that Darren and Michelle and Owen and I be allowed to do it in Coinside. The problem is that there's no room. Will there always be no room? No room? No room in the inn? Could we come and be here? And that's marvellous, because people just, it's easy to have access to the specialist in that situation. There's no stigma to it, I think. I mean, you know, apart from the contamination we see in me. But people come. And the marvellous thing is, it's just where you go to see the doctor, and it's not, and I think what Hannah was saying, people don't have just dementia. They have this, that, the other, and what have you, and they've had things in the past and they'll have things in the future, so it's part of a spectrum. So I think working with general practice is so important, not setting people too much apart, but on the other hand looking for their special needs and so on. So the first thing is getting everybody to know about it. What are we going to do to raise the profile? And the next is, when people say, well, I'm a bit worried about this, what's going on, that we can provide a high quality assessment, investigation and treatment facility. And I suppose what I'm most concerned about tonight is to say, well, we've got actually, I think, a very good memory service, memory team. We've got Darian, we've got Michelle, we've got Owen here from that team. And we certainly want anybody who's got a problem, practitioners who identify with the problems, to feel that we're available and that you can refer to us and we will see people. Yeah? But it's marvellous if initial workup, and I guess Dr. Hanlon led me into this, is done well by families and by the practice. I saw a patient yesterday from the Dowling practice, you know, not actually done by Dr. Dowling this time. On 2 pages, a complete story about this person as an individual, an MMS, a mini mental state measurement, so they've done sort of measurements and so on. All the investigations, ECG and so on.